Okay, here we go. All right, well, welcome everyone. I'm Catherine with Blue Wave Physical Therapy. I'm the physical therapist here. And today we're having a webinar about foot pain, balance, and just all things feet and how you can address those symptoms. And okay, so who is this for? This is addressing for people who have foot pain when they first stand up in the morning. That is one of the biggest complaints that I hear. It's for people who are limited their activities. They're not walking as much, they're not moving because they have foot pain. People who say they have weak ankles or they just don't feel stable. So as they move around, they're very cautious and very fearful about falling. Or people who are just conscious about what shoes they have to be wearing. They're afraid to wear heels because of pain afterwards, or instability, or having the right kind of supportive shoes. So those are common things that we hear at the clinic. So what I'm hoping you learn today is why foot pain is so common and why it affects most people at some point in their life. The most common treatments and medications, and how you really can address your foot pain naturally without medication, procedures, and surgeries. So even if people have told you you need something, you have to have a bone spur, kind of smoothed out, things like that. There are things that you can do, before going straight to surgery. So for those of you who don't know me, like I said, I'm Catherine. I've been a physical therapist since 1997. I opened Blue Wave 2 years ago with my sister, who's also a licensed massage therapist. And our mission is to help active adults get back to exercising, feeling fit, and enjoying the activities they love without injections, surgery, or medication. So that is really our mission here, is to help people with their whole body wellness. Personally, in my spare time, I enjoy swimming. Part of reasons why we have an aquatic center here. I have 3 kids and I like to watch sports. So normally I put up a picture of my immediate family, but I thought this one would resonate with all of us. This is my extended family on evacuation day 10 when we were all full of snacks. So we are in Atlanta. My parents, my brother, sister, the only one missing is my oldest, who was still away at college. So, and the cat was also there. So we made the most of it and snacked too much. So it's time to get back to some overall good self-care now. All right, so we'll get into it here. Foot anatomy. Now, I have a picture of the bones and muscles here on the left. There is a lot to go over. It is very complicated there. So I'm going to give you kind of the summary here. You have 7 what we call tarsal bones that make up the heel and the back of the instep. So that's this calcaneus and the talus and these small tarsal bones. They move on top of each other and rotate, and they create the arch in your foot, and they really help with shock absorption. When you put your body weight down onto your foot, ground reaction forces, that's what they are good for. From there, we have 5 tarsal bones that spread from the midfoot out, and then is connected to one at each of the toes. And then 14 phalanges, which are the small bones on the end of the feet there. Let me go back here. The tarsal bones, like I said, metatarsals, they provide the structure. And then this is all held together by ligaments. So what you can't see here is underneath those muscles and tendons that there are ligaments that connect all these little bones together to provide some stability. And then on top of that, you have muscles on the bottom of the foot, you have muscles on the top of the foot, and you have a lot of muscles that come from your lower leg and your calf that control the foot. So you can see all these tendons that come down across the ankle into the toes. So even people who have trouble moving their toes, it's actually a muscle in your calf, in your lower leg, that controls that. And then we have these fat pads. So we look on the heel on this left side here. That's like the cushion on your heel. You also have some fat pads on what we call the balls of your feet, underneath the midfoot and the bottom of your toes there. So those are fatty tissues that help absorb pressure and shock. they tend to wear out over time and with age. So you may see, I have one client right now who runs marathons. She's in her mid-50s, and she said her biggest problem is that she has worn out the whole fat pad in the ball of her foot. So that is her limiting factor. So all of those things combined work together very meticulously and in a rhythm to provide the proper shock absorption. So the foot and ankle, they have two important jobs. Mobility, meaning that you have motion and flexibility to support your body weight and to support the ground reaction forces. And it needs to have stability, which means it locks out the foot in order to push you forwards when you're walking. So the adequate mobility is shock absorption. It allows us to walk on uneven ground, to adjust to our crooked sidewalks, when you hit a hole in the grass and your ankle adjusts, and then stability to push you forwards. So if you don't have good stability in the foot, if you don't have good strength in the foot, walking takes a lot more energy. So failure of those foot and ankle to coordinate this transition, we call it transition from mobility to stability. So you need to transfer weight. When you put weight on your foot, it's got to move a little bit to absorb the shock and balance. And then it's got to switch to stability to push you forward for the next step. So failure of those things to work correctly and coordinated is basically the major problem for mechanical and foot problems. And we say mechanical because it has to do with the way it moves. So this picture is one of my favorites that may not be super easy to read. It's got the official names, but this is one thing that I really try to work with my clients on, is that when you have foot pain, it doesn't just affect the foot, or it's not always caused by the foot, because our whole lower leg works in absorbing weight. So when you step on the ground, your foot, and we're gonna look at the left foot here, it rolls into what we call pronated position. That's when the foot turns in. It's going to rotate your lower leg, your tibia. It's going to cause a little bit of force on the inside of your knee. It's going to push it in a little bit. Your upper leg rotates a little bit, and your pelvis. So that is how the ground reaction forces are spread throughout our body when we take a step. That's how we accept it without the constant pounding. Go back there. So for all those internal rotation motions that we take when we put our foot on the ground, our body has to switch quickly to an external rotation to stability in order to take the next step, to push forwards. So there's a whole cycle here. And this is called kind of the gait cycle. And I know this is a lot of information, but I'm going to point out a couple important things. So we're going to look at the shaded foot, the darker one. So when you first hit the ground, your heel hits the ground first, and then it goes flat. And this is where you start to have that internal rotation of your foot, and the pronation and the rotation up your leg. It levels off here. And then as you start to switch to getting ready for the next step, your body is going to switch to the external rotation, supination, lock out the foot in order for you to push off, to push towards the next step. So give me a nod if that makes some sense, or if you want me to go through it again. That makes some sense? Okay. So the bottom two pictures here, you can faintly see I drew a little red line with the angle there. And this is something I want to point out. Look how much bend in the ankle that you need for that step. So that's about 10 to 15 degrees of what we call dorsiflexion, being able to pull your foot up. This is one of the first things that I see as a problem with people who come in, even if they're having hip pain or knee pain, is that they're tight there. And if they don't have enough bend in that section, our body's going to find other ways to get it in order to get the foot over, to get your body advanced over the ground and over your foot. So that tends to be overpronation. It tends to be what I call the weeble wobble, going back and forth. So this is one of the first things that I will tackle with somebody with lower extremity things, is making sure that you have good stretch and good strength or length in your heel cord or your gastroc. That's what it's called. Then the other thing that's important is not only this angle here with that foot that's called foot off terminal contact, but you're also activating your hamstrings, which are in the upper leg here, and your hip extensors, which are way kind of up on the top here. So you need to coordinate the hip, the hamstrings, and have enough bend in this foot in order to push yourself forward for the next step, in order to do it efficiently, and to have the proper mechanics where nothing is being overused. So hip strength, hamstring flexibility, hamstring strength, heel cord strength, and flexibility. Those are so important in walking. So we have 2 points of failure is usually right here where we load up the body, and really here where we step over it and having enough motion. I keep pushing the buttons and it advances too soon. So foot problem is not always foot problem. So this is a picture I used in my knee class, actually, that we have different body positionings of our hips and our knees. That could be one, the way you're born, your genetics. It could be knee injuries. It could be just degeneration, arthritis. So we all have seen people who have their knees that kind of come together, and we've all seen people who are bow-legged here with this varus. But you can see that when the angle that the hip and the knee is different, that changes the angle of your feet and your ankles as well. So if your foot, say this knock knees, if your foot's already turned in, when you go to accept weight on the foot, there's not a whole lot of extra space for that foot to come down and absorb the weight. So I have some clients, I know some of y'all know who you are, whose feet are very pronated, and there's not a whole lot of room for absorption there. So that's something that we need to work on. So another way to look at it is looking at the back of the feet. And I'm sorry, this picture is not real clear, but ideally from the back of our legs down to this calcaneus, which is that backbone in your heel, it should be a straight line. For us, for our foot to mechanically work efficiently, we ideally want this to be in a straight line. So the person with the rear foot valgus on the left, that is somebody who's pronated, overpronated, and the one on the right with the varus is that's somebody who's supinated, or we say has high arches. I do see both in the clinic. We'll see the varus, the one on the right, with people who are bow-legged. We'll see that a little bit. But the rear foot valgus is the most common thing that I see, where we have a breakdown in this medial side, the inside of the feet, and the arches there. So those are the most common things that I see. So what kind of foot pains are common? So I kind of made a list. This is not an all-inclusive list. There are certainly other things, but these are names and things that people kind of hear talk about. Bone spurs, plantar fasciitis, which is pain on the bottom of the foot. Achilles tendonitis, which is soreness on the back of the ankle along that large tendon. Hammer toes, which is when your toes in the front, they curl up a little bit. Neuromas are thickened nerve tissue that usually occurs with women who wear heels or narrow shoes. It's usually between the second and third toe. Shin splints, recurrent ankle sprains, and instability or falls. So those are common things that I hear and see. And believe it or not, I treat them all very, very similar, because we're going to look at the symptoms that cause those problems. We try to get to the root cause of why these things are coming on. So medical treatments. If you go to your physician with this kind of foot pain, this is usually the responses that you'll get. Number one, an anti-inflammatory medication. So NSAIDs, which is your Advil, Aleve. Sometimes they'll give you something that's prescription strength to try to calm down the inflammation. Those can be very effective, but they are not effective for a long-term issue or chronic issue, mostly just because of the side effects of the the anti-inflammatories. Bracing, and we'll talk about that a little bit, but I'm sure y'all have seen people walking around with those big boots that kind of brace the foot and ankle in. That's a common way to rest the foot, is very helpful, but I also see some other side effects with those, which we'll go through. Cortisone injections, that is very common, especially with the plantar fasciitis, bone spurs, any kind of tendonitis is where they are injecting an anti-inflammatory directly to the spot. Side effects of cortisone, not everyone tolerates it well. Over time, it will cause actually accelerated breakdown of ligaments and joints. So while they are very helpful in the short term, if one doesn't help, two isn't necessarily the best idea. And surgery, a lot of podiatrists are doing surgeries to smooth out bone spurs, to release the plantar fascia, to do a release of the Achilles tendon. There are lots and lots of different options. Bunionectomies, there's lots of things that they can do with the feet. Some of them, again, extremely helpful and worthwhile, but recovery is never super easy. There's always challenges there. So we want to find ways that we can address those without those medical interventions. So these, I've listed the 5 most common things that I see on a foot or ankle evaluation, and we're going to go through them one by one on how to address them. So the first one is, we've already mentioned, the tight posterior calf muscle, your gastroc, it's called your heel cord. That is almost tight in almost everyone, and the first thing we need to target. Weak muscles in the lower leg and in the foot, tight hamstrings, weak hip abductors, and poor balance. So no matter what the cause of the foot pain is, these 5 symptoms usually present across the board, and with addressing these, it makes a huge difference. So we'll kind of go through them each one at a time in ways that you can start dealing with these things at home. All right, so the heel cord, the tight posterior calf muscle, there's 2 different ways you can stretch it. The one on the left is a standing lunge stretch. Some people call it a runner stretch. Very effective if you keep the back knee straight and that heel on the ground. For people who are really tight, this is painful, or their bodies find ways to get around it. For example, turning the toes out, those ways. Move this out of the way. I realize it's going to block my screen. The other one is the towel stretch. So this one is low force. It's usually pretty pain-free, where you can get a towel, a belt, a strap, and put it underneath your foot and pull towards you. All of these stretches, you want to hold 20 to 30 seconds and do at least 3 repetitions. So the advantage of holding it for a long term, I tell people, if you pull a rubber band once and then let go of it, it pops right back. But if you pull a rubber band, hold it for 20 to 30 seconds, or put it around a pack of pencils, I should say, hold it for a week or 2, when you take that rubber band off, it's all stretched out and kind of flimsy. So our muscles respond the same way. They're going to respond to a light stretch held over a long time. If you stretch something as hard as you can, it's going to be sore afterwards, it's going to hurt, and you're not going to really want to do it again. So I always tell people, just go to where you first start to feel it stretch, hold that, and then repeat it a few times. So those are 2 active stretches. The third option is a night splint. Now, especially for people with Achilles tendonitis and plantar fasciitis, the night splint is super uncomfortable, but really, really helpful. It provides that low load of stretch for a long period of time. And also when we lay down, normally if you lay on your back, gravity kind of drops your feet down. So it makes that in the back of your calf tight again. So this keeps your feet from dropping. These are 2 different options. Obviously one is much bigger and bulkier than the other. The one on the right really stretches the bottom of the foot more than the heel cord, but both of them are effective. I have another one here that goes on the front of your foot, and you strap your heel in here and strap it on for the night. I've used this is mine. I've used it over the years, and when I feel that my foot's starting to bother me, I can wear this for I wear it for an hour before I go to sleep, and that within a few nights, it usually solves my problem. So these are some real easy options that you can do at home. The night splints are not super comfortable, and not everyone's compliant with them. And I understand that, but they do help. So that is a really good first step. Any questions about those so far? Good? Okay. All right, weak lower leg and foot muscles. So I am just giving the beginning exercises that I tend to give on the first day. The left heel raises, going up and down on your toes so that you're strengthening that gastroc muscle, the same muscle that you just stretched in the last exercise. Gaining some mobility in your foot by turning it in and out and having control over that. And those you need to do like 10 to 20 times, and you will find they fatigue out, they wear out. It seems like an easy thing to do, but when you do it consistently, using your full range of motion, it will wear out. And then the last one here, I call the towel toe curls, where you put a towel on the ground and you just curl your toes up like this, and it's going to work the muscles in your bottom of your foot, the muscles that help support that arch and around the plantar fascia at the very bottom of the foot. Again, this looks super easy, but if you set a timer for yourself and do it for 2 minutes, your whole lower leg is going to be worn out. You're really going to feel it burn in a little bit. So it's using all of those muscles in the calf to activate the toes. And I do have some sheets that I can email to everybody who's participating, or if you want it afterwards, you just let me know. But that has all of these exercises I'm talking about on one sheet with directions. Okay, tight hamstrings. So I talked about that those are super important, that your hamstrings are flexible. Again, they help that gait cycle in order for your body to absorb those rotations and weight acceptance. So this is one way to stretch, putting it up on a chair, making sure your knee is dropped straight and leaning forwards. Now, this is not easy for everyone to balance. So of course, if you do it in this position, you want to hold on to something, because most people who have ankle and foot pain, their balance isn't fabulous. So hold on to something, or you can do it laying down, and you can do it with the strap here. I have a little video where you put the strap behind your knee and you can actively stretch that hamstring. Again, it may not be as much force as the standing one, but you won't have to worry about falling. You won't have to worry about overusing, and you can stretch it that way. And if you don't have a strap, you can just grab behind your knee and stretch that way. Okay. All right, so those are 2 easy ways to stretch the hamstring. Again, very important and very tight in most people with lower extremity pain. All right. So the next one I talked about was the weak hip abductors. So these are the muscles on the sides of your hip. I'm going to stand up here and hopefully you can see, but right on the side. This is really where we absorb a lot of that weight when we take the step, and we talked about that picture that showed everything rotating in, and then you have to stabilize and turn and rotate everything out a little bit. So this is really where we absorb a lot of that weight. One way to test if you're weak at home is if you try to stand on one leg. Let me back up so you can see that if that is weak, it will drop. Your hip will drop a little bit. So you should be able to stand on one leg, hold your hips level, and that's to get some information about how that hip is doing. So you may find that one side is different than the other. But if you are tipping over, or if that hip is dropping, that's a sign that you need to do some strengthening there. So this is, again, the most common one I'll do is laying on your side, doing the leg lifts on the side. I call them the Jane Fonda exercise. You can put some leg warmers on. And the main thing is making sure that your body stays aligned, that your leg is exactly in line with your shoulders and your head. We tend to find the easy way to do it, and our feet will they'll slowly glide forwards in front of us. So you need to make sure that your hip is aligned straight. Building up, if you can do 3 sets of 10, that's a really good start there. Okay, next one, and the last one that I see is poor balance. So who feels that they could do this pose? Not many of us. This is not easy, but you should be able to stand on one leg. When we walk, every step that you take, when one foot comes up off the ground, the other foot is managing all of your balance. So if you are unstable, again, that's extra work that your body has to do for stability. That's why people tend to be cautious and avoid uneven surfaces. They don't feel stable. So this is one thing that definitely needs to be worked on. And if you have addressed all the things we talked about beforehand, meaning the tight heel cords, the leg and hip strength, the hamstrings, your balance will improve dramatically. Recently, I had a gentleman come in who did not feel safe walking through the grocery store, couldn't go down curbs. His feet hurt so bad. And we discovered his problem was really his hips were so weak. And after addressing his hips for 5 weeks, everything else got better. He's walking, he's shopping without holding onto the cart. He's not having the foot pain. He feels more stable. He's carrying his grandbaby. So balance will improve if we've addressed the 4 things that we talked about before this. But there's also things to do to help you balance. So when I found this picture, the kitty actually moves. Whoops, oh. But I couldn't make it move on here, but I thought that was fun, have a little wobble board. So getting better at your balance is practice, just like anything else. So you can start with, can you stand on one foot? And we can even go through some balance tests that we can do here. Can you, when you get up out of the chair, can you stand up without using your hands? If not, strengthening. Can you stand up with your feet close together? You should be able to stand for at least a minute with your feet close together and feel pretty stable. Can you stand on one foot? How long? Ideally, we want 20 to 30 seconds on one foot. Can you stand with one foot in front of the other, like you were walking the line or a balance beam? Can you just stand with one foot in front of the other? Again, ideally 20 to 30 seconds. If any of those activities are a challenge, balance is something that you need to work on. So one of the easiest ways that we do is first standing on one foot. Now this guy's in the middle of the room, which means he probably feels pretty secure about his balance. I would recommend that you have a countertop or a chair, something to hold on to, that even just a finger can make a huge difference in giving you some stability. And then you work towards letting go of all that stuff. And then you can make them harder. So this second picture, he's on a balance disc. There's other options like I have here, which is a wobble board, just like that cat's on. Has a little round piece on the bottom, so it makes it unstable. You can do these in the wobble board sitting down and then progress to standing up. Again, hold on to something. And then another easy thing that without having to buy is you can get foam, like the gentleman in the third picture, or just a pillow to stand on. So when you take that uneven ground, make it uneven under your foot, you challenge your balance and your body starts to respond with your lower leg muscles responding, the muscles on the bottom of your foot responding, your hip muscles responding, all of those things. So balance can certainly be trained and it will improve practicing it, as well as, you know, everything that you've done before to address some of those foot issues. So exercises for foot pain relief. I kind of just threw out you my very basics and I'll give y'all a sheet with all of those. So movement is medicine. It brings blood flow to our muscles and our joints. It spreads pain reducing endorphins throughout our body. So it's good for everything, but how you exercise matters, and doing it properly is super important, and doing it safely. So the correct exercise routine will definitely make you feel better, and it will have lasting effects. The wrong exercise will make you feel worse. So it's important to start slow and listen to your body. If you feel you've done something that creates more pain, you need to back off, not do as many, not do it as intense, or seek help to figure out what the difference is. So that's where I come in as far as physical therapy. So if you've been to any of my classes, you may have seen this slide before. Our goals are the same. Decrease your pain initially, restore your mobility and your flexibility, restore your stability, meaning getting stronger, and restore your functional abilities. So address your balance, stepping, squats, walking in the grass, walking on uneven surfaces, being able to do the grocery store without pain, all of those things. So if those exercises aren't working for you at home, these are additional things that we can do that are still conservative measures for the foot. One is going to be a full assessment of your walking pattern, so we can see where in that chain of events things are breaking down. Is it that you don't have enough pronation, or you already have too much pronation so there's no absorption of your foot? Are you rotating too much? Do you not have the hip strength for stability? So that's something that we will nitpick and look through where some of those deficiencies are. We can do hands-on mobilization of the foot and the ankle. So frequently there will be restrictions. So we talked about the first thing is to gain the flexibility and mobility so you can absorb weight. So we would do a lot of mobilizations that way. Soft tissue mobilization, massage to the bottom of the foot. Sometimes this is really painful, but it's super helpful. And along the calf muscle, we'll find that all those muscles that have those tendons that lead into the foot, they tend to get kind of sticky and have some restrictions if you've been protecting it for a while, or if you've had long-term inflammation. So mobilization in those muscles. Taping, kinesio tape, in the left picture there, we're doing that for somebody. We found that kinesio tape has been very effective to provide some neural input to help those muscles activate the way they're supposed to, help with blood flow, help with inflammation reduction. So it's often a really good start to allow you to exercise without pain. And then of course we'd advance the strengthening and balance training that's really geared directly to you and your problem, whatever your particular issue is. And then the last thing is orthotics, and that's something that people ask me about all the time. So if we have done a lot to restore some flexibility and strengthening, but we're not getting over the hump, or not getting the lasting effects, or if you feel good as long as you have this pair of shoes on, but pain comes back with this pair of shoes or without shoes, then getting an orthotic to add some additional support may be helpful. Some people have fixed changes in their bones and their ankles where they have restrictions. If you've had a previous ankle fracture, orthotics can really help to give the support that you need and help those muscles be able to work more effectively. So off-the-shelf orthotics that you can get at a shoe store or running store often do the job, and they're a very good short-term immediate relief option that can decrease the joint stress and decrease pain. They're cost-effective, meaning they can run anywhere from $20 to $60 usually. The challenge is they usually don't last more than 6 months if you wear them all the time. So I found that there's some shoe stores in town that kind of look at your foot and they find the right off-the-shelf orthotic, and they've been very helpful for my clients. So that is definitely an option. For those that want something that's more long lasting, or the over the shelf just has not helped them, we can do custom orthotics where we cast the foot and send it off, and you have something that's made for you, specific for your problems and your alignments. In this particular company, there's lots of different options on how firm, how soft, what kind of shoes, if you're doing for everyday use, if you're doing for athletic activities, if you want them in your heels or your your loafers or flats. You know, there's lots of different options. So they're a more expensive option, but they are much more supportive. They address all the arches in your foot, not just the arch that everybody talks about with your pronation. There's also arches across the bottom of your foot and on the outside. So these custom ones will give support in all three of those areas. And they're a little bit long lasting. So those are other options that I will go through with my clients, especially if they're not getting the results that they need from everything. With somebody saying New Orleans Shoe Company has been helpful. Yes, and Fleet Feet is another store that is extremely helpful. They're a running store, but they have fit many of my clients who are not runners, you know, just for day-to-day stuff. So there are some good options out here too that I can, if you have questions. And then the last thing are topicals. And this is a picture of all of our CBD products, but the CBD oil on the left, I find is very effective for people with foot pain. And you can put it on the bottom of your feet. You can put it on during the day, but especially at night. The bottom of your foot has lots of receptors that pulls in these essential oils. So it's actually a great spot. So you get the pain relief there directly, but you also have it absorbed into your body for some anti-inflammatory type effects and really helps some people sleep really well. So that's also an option that is not a straight up medication. So that is kind of a quick overview of the foot and ankle. I'll be happy to go through any more specific questions about specific diagnosis or specific problems or what the foot looks like. But in general, I wanted to give y'all information on the 5 things that I see clinically that we always need to address in order for foot pain to improve, even if the problem isn't your foot. You know, it may, like I said, it may be your knee, it may be your hip, it may be flexibility, but mechanically you feel it in your foot because it's all important in accepting body weight. So, any questions so far? No, all good? Okay. Well, I will send out the exercise sheets to everybody who's on right now. And if you're watching this later and would like a copy, just please let us know. And obviously, if you have any other questions, we're available for consultations to talk to you about it and see if we can help you get set in the right direction. All right, everybody. Y'all have a good day. And I'll see y'all later.